COVID-19 has had a profound effect on the world, and in the months of March and April, Europe has been at the centre of the pandemic. Slovakia, a country in the centre of Europe with land borders with 5 other countries, has managed to have the lowest death rate per capita of any European country. In this video we will outline the actions that the Slovak government has taken and the response of the Slovak people, and how Slovakia beat the pandemic. Okay, we're in our local supermarket, and first thing you'll notice is I'm wearing a face mask. Face masks are compulsory here in Slovakia. Second thing is, on entering the supermarket we had to have hand sanitizer, and we have to take a trolley with us to keep 2 meters apart. You'll also notice on the floor there is markings to tell people how far they should stay apart from each other. One thing that was interesting in the first few days of lockdown and before the lockdown is there was no panic buying here in Slovakia. We didn't see shelves cleared full of food items. It was pretty much as normal. So that's about it really. You can buy whatever you want in the supermarkets, and we'll have a look at a few other shops which are now... Okay, so since March the 30th, some additional shops in Slovakia have been allowed to open, as well as the pharmacies and the supermarkets, and one of those has been bike shops. So how cool is that? So here we are in the centre of Bratislava, and you can see that some of the bars are now selling drinks and food off the premises. You're not allowed to consume on the premises, but there's starting to get a bit of business started up now in the centre. Here we are social distancing by 2 meters in the queue for the ice cream. So since March the 13th, the borders of Slovakia have been closed. This is one of the examples. This is a cycle and footbridge over to Austria, and it's officially known as the Most Slobody, but unofficially it's known as the Chuck Norris Bridge, because nobody crosses Chuck Norris, and I think with COVID-19 that's probably the right name. So we're just on our way back from the Chuck Norris Bridge, and we've come across this, a face mask vending machine. So a few months ago this might have seemed a bit bizarre, but now it's a pretty good idea. Right, here we are at one of the border crossings between Slovakia and Austria, and it's pretty interesting because normally this is a completely open border and you can use the cycle path to cycle across, or the cars can just come to and from Austria without any trouble at all. But now we have a closed border, and it's a pretty interesting situation. Just over here, these people have come into Slovakia from Austria, and now they will be going into quarantine in a state facility for up to 14 days. After that, they must self-isolate at home for a further 14 days. The Slovak side are just letting cars through, but then on the Austrian side, the Austrian police will be then checking cars going through that side, and the Slovak police are checking cars coming through here, coming from Austria. Some people can now come to and from Austria, depending on if they live within, I think, 30 kilometers of the border. But yeah, this is a very different situation to what it has been normally with what was a completely open border. And to be honest, I wouldn't like to be going into quarantine now in a state-run facility.
Key to Slovakia's success in controlling COVID-19 was its rapid response. In February, as COVID-19 cases in Italy started to grow, Slovakia introduced checks, including measuring people's temperatures, at its airports and borders. The first case of COVID-19 was diagnosed in Slovakia on March the 6th. On the same day, there was a ban on all visits to hospitals, old people's homes and prisons, and flights to and from Italy were stopped. 3 days after the first case, on March the 9th, schools in Bratislava were ordered to close, and there was a national ban on all public events. Quarantine was made compulsory for all people travelling from China, Iran, Italy and South Korea. 6 days after the first case, on March the 12th, a state of emergency was declared by the then Prime Minister Peter Pellegrini. Airports, bars, sports and entertainment venues and shopping centres were all closed. Quarantine was compulsory for all people returning from abroad, either at home or in government facilities. Only people with Slovak residency were allowed to enter the country. Effectively, Slovakia closed its borders to the rest of the world. 10 days after the first case, on March the 16th, all shops and restaurants were closed except for essential shops such as supermarkets and pharmacies. Face masks became compulsory on public transport. 15 days after the first case, on March the 21st, the new government, led by Igor Matovic, was sworn in. All the participants at the ceremony, including the President Zuzana Chaputova, wore face masks and gloves. 18 days after the first recorded case, on March the 24th, extra medical supplies from China, procured by the Slovak government and private companies, started to arrive. Also on March the 24th, face masks become compulsory in Slovakia in all public places. A law was passed allowing the state to use mobile phone location data to track people's movements, and special hours only for the elderly people to shop were introduced. 24 days after the first case, on March the 30th, stricter hygiene standards for shops were introduced, and some additional shops were now allowed to open, including opticians, bicycle shops and hardware stores. On March the 31st, the economic support package for employers, employees and self-employed was outlined by the government. On April the 1st, testing of Roma settlements was increased in eastern Slovakia due to the high risk of the virus spreading within these very marginalised communities. 1 month after the first case, on April the 6th, everyone entering Slovakia now had to go into quarantine for up to 14 days in a state-run facility. The first death from COVID-19 was recorded in Slovakia on April the 7th. Temporary travel restrictions were put in place during the Easter holiday, limiting people to their own district. 5 Roma settlements in eastern Slovakia were quarantined as testing showed a rapid spread of the virus within these communities. On April the 8th, temporary accommodation was set up for the homeless in Bratislava. On April the 20th, less than 7 weeks after the first recorded case of COVID-19, a 4-phase plan to end restrictions was announced by Igor Matovic, with the first stage starting on April the 22nd. The plan is for Slovakia to move through these stages if the average daily infection rate is below 100. If you compare these measures and the timing of these measures with those of other countries, you will see that Slovakia was one of the fastest to take action. Based on the numbers of per capita deaths, we can see that these measures have been very effective at controlling the spread of COVID-19. We hope you liked the video. Best wishes from Slovakia.